This is Gloria Goodman with Gigi Skin Therapy in Albuquerque, New Mexico, and I wanted to talk to you a little bit today about chemical peels. In the past, chemical peels have gotten this bad rap of making your skin raw and irritated and peel for days, and you ended up looking like Samantha on Sex and the City with the big red face, having to wear a beekeeper hat just so people didn't have to see you. And maybe it was like that back in the 60s, 70s, 80s, even 90s. But these days, there are chemical peels that are corrective and can really affect change in your skin. And the new ingredients that are being put into the chemical peels give you a much better corrective result without all of that downtime and inflammation. I happen to use a company called Lira Clinical, that uses amazing chemical peels, everything from the lightest pumpkin all the way to a pharmaceutical grade TCA. The difference with these peels is that we incorporate plant stem cells and peptides and minerals of gold and silver in the peels, so you get a much quicker healing process. We also believe in pre-treating the skin, and I think this is really important. Not to just walk into an esthetician's office or a doctor's office and have them slap a chemical on your face without you preparing for it. It's almost like running a marathon without ever stretching or walking around the block. Your skin will inflame. You can get post-traumatic pigmentation, hyperpigmentation. Those brown spots will come up, especially if you're not pre-treating and then post-treating to heal your skin properly. So with my business and the way that Lira Clinical works is that you would use products like our Pro Light, which is a little serum that you will put on the skin several weeks prior to having the peel. That will suppress the melanin in your skin and prevent those dark spots from coming out. You're also instructed to use a really good chemical-free sunscreen, sunblock with zinc and titanium dioxide to help deflect all of the UV off of your skin, because UV will excite the melanin and bring pigment back to your skin. And sometimes, you know, the healing process is very, very important as well, where after you do a chemical peel and you have shed layers of skin, you have that brand new baby skin underneath that needs to be treated. So you do not want to use any alpha hydroxys or retinols afterwards. You want to use vitamin C serums. You want to use the Pro Light, which is a C-phenyl stem cell to help suppress the melanin and also to help repair any damaged melanocytes that you may have in your skin. And this really, really will give you a much, much quicker heal process, and you will get a much better result. So something else that Lira does, and I do in my practice, called the 3D peeling. 3D stands for 3 different peels. And the way that we work our peels is we prepare the skin. We are going to get in there with probably a salicylic-based chemical peel that will melt the top layer of the epidermis so that you can 2 weeks later, get in there with a really corrective peel. Maybe do a Gessner if you have an acne client, or a TCA if you want to correct pigmentation and wrinkles. And when that skin heals 2 to 3 weeks later, we will do something to regain the structure and the moisture in your skin. Maybe do a lactic, maybe do something called Vitabright, which is a vitamin C hydrating peel to restore the barrier function of your skin. And all of these things will really correct and give you the best possible peel treatments necessary, rather than just throwing you in there, just like Samantha on Sex and the City with a big red face and ending up with more damage than you started with. So anyway, just a little bit of insight into chemical peeling. Good time to do it right now. We're starting to get into fall season and everything's cooling down a bit. You're not in the sun quite so much. So go out there and happy peeling.